So certainly within the NHS we're seeing challenges around managing intake capacity and the demand currently under the hospitals, and with local and regional government it's probably more from a commercial and budgeting perspective, so delivering the cost of delivering adult social care within the community. So we're certainly seeing the biggest demand in predictive analytics. From an NHS perspective, just to understand the likelihood and requirements from an intake perspective into hospitals, but actually looking further back from that, the local regional governments are really interested in understand how they can actually intervene early to prevent hospital admittance and the subsequent after treatment that follows on from that. So from an NHS perspective, being able to predict the intake and demand on the hospital can allow them to align resources more appropriately and make sure that healthcare is delivered in a much better and more efficient way. For local and regional governments, it's from a budgeting perspective, it's actually 80% of the budget is consumed by around 20% of the population within adult social care. Yeah, so we're starting to see a number of NHS trusts form what's being referred to as command centres. The primary purpose of these command centres is effectively to provide real-time insights back into the hospitals to allow them to predict both demand but also where they need to put the right resources within the hospitals. From a local and regional government perspective, we're seeing the formation of separate legal entities funded by the councils who are actually working in collaboration with the NHS, whose prime purpose is to deliver adult social care in a more efficient way.